Reflux and spitting up in newborns is so common, but when is this more than just a laundry problem, and what can parents do to help? I'm Dr. Lena Vanderlist. I'm a mom of two and a pediatrician with UC Davis Children's Hospital, and today we are talking about reflux in newborns and infants. First, some good news. Physiologic gastroesophageal reflux is completely normal in babies. It usually peaks between 3 to 6 months of age, and it happens when the stomach's contents flow back into the esophagus and sometimes all the way up and out of the mouth or even the nose. Babies are especially prone to reflux because their stomachs are small and the distance between their stomach and their mouth is short. And that muscle that prevents regurgitation is underdeveloped. Also, their diet is entirely liquid and they spend a lot of time laying flat without the help of gravity. So as long as your baby's spit up looks like milk or curdled milk, is not forceful or projectile, and your baby is feeding comfortably and gaining good weight, then it's likely just physiologic reflux. It will improve with time, and you do not need to do anything special. So when is it something more? Gastroesophageal reflux disease, or GERD as many people are used to calling it, is when reflux starts causing problems. This may be significant discomfort, feeding refusal, or poor weight gain. Any baby can develop GERD, but it is more common in certain groups, like premature infants. Most of the time, GERD can be diagnosed based on a child's symptoms alone. And treatment really depends on the baby and the severity of the symptoms. But we always start with some feeding adjustments. So offer smaller volume, more frequent feeds, or for breastfeeding moms, they may just offer one breast per feed. In the past, you may have heard that you should raise the head of the crib, but this is not recommended as it does not follow safe sleep guidelines. Can diet play a role? Absolutely. For both breast and formula-fed babies, food protein intolerance, most commonly to cow's milk or soy, can contribute to reflux symptoms. So after checking in with your pediatrician, a trial of eliminating milk or soy from a breastfeeding parent's diet or trying what's called a hypoallergenic formula may be helpful if the other modifications have not worked. And sometimes medications are needed. The good news is it's usually for a pretty short period of time. Acid-suppressing medications can reduce discomfort by lowering the acidity of the stomach, but they really won't stop the spit up itself. So make sure to talk to your pediatrician about the risks and benefits of these medications. The great news is that most infants outgrow GERD by their first birthday. And research shows that infant reflux is self-limited and does not cause any long-term problems. So hang in there, your washing machine is not going to be working overtime forever. We go more into detail about infant reflux and GERD in our recent episode of the Kids Considered podcast. Thanks for watching, and don't forget to subscribe for more little lessons from UC Davis Children's Hospital.